It's been several months since we talked to you. At that time, there was the CMS mandate looming, but it was on hold secondary to a lawsuit. As you know, that lawsuit now has kind of moved forward, and now the state will be kind of enforcing that CMS mandate. And so as you've heard that throughout your hospitals, we thought this would be a really good opportunity for us to give you a chance to ask any additional questions that you had regarding the vaccine. So as part, I think it would be helpful just to give you a quick update from a state standpoint on where we are right now in the pandemic. So if you've been kind of following along with the Department of Health's dashboard, you've seen that we around the state in all counties have had the peak of the Omicron wave. So we've seen the maximum number of cases in this recent wave, and now we're on a pretty dramatic decline. In some areas, it declines as much as 70 and 80% in terms of new cases. We're also seeing declines across the state in hospitalizations, which is also an incredibly good thing, as well as starting to decrease the resource needs and decrease some of the stress that has been put on all of our healthcare providers around the community. And so from a timing wise standpoint, I think we're really looking pretty good moving forward over the next several weeks in the state. The state yesterday did put out some new guidance around schools that's available on the Department of Health's website, and around the decreased need for contact tracing and some of the now mandates going more to, well, take that back, some of the recommendations around mask wearing. So overall, we really do seem to have seen the peak of Omicron. We're now on the decline. But as you think about your current roles, this is still really an important time for us as the state and as you as healthcare providers to continue to do what we've been doing throughout the pandemic to decrease the risk for those that we care for. I think as healthcare professionals, we are unique in that we put the needs of another person ahead of our own. And that's been really part of the recommendation from the beginning around getting vaccinated, around wearing masks, around hand washing, and all of the things that we've collectively done to keep those that we care for safe. So as we start looking at moving forward here in the near future, as we look at this CMS mandate now being enacted across our state hospitals, we thought it'd be a good time to answer some of the questions that you've submitted as part of this. So we're going to let Jay moderate, ask the questions, and I think there'll be ones for each of us to answer.
Great, thanks, Dan. Before we get started with the questions, I wanted to just clarify what the CMS mandate is. So CMS is the Center for Medicaid and Medicare Services, which is the federal agency in charge of administering those programs. And there was two mandates actually that were recently heard by the Supreme Court. One was an OSHA mandate, which was to apply to workplaces generally across the board. And then one was a CMS mandate where any agency or organization that received funding from or was certified by CMS would have to adhere to the vaccine mandate. So the OSHA mandate was struck down, the CMS mandate was upheld, and the Biden administration announced that they were going to go forward with enforcing it. So that's why we're here today, because the hospital network receives funding from and is certified by CMS. So I just wanted to clarify that. Dan, the first question that we have is around the whole concept of natural immunity. Yeah. Some folks have brought up the notion that they've had COVID already. Aren't they immune? Why do they have to get the vaccine? What does the data show on natural immunity versus the vaccination?
Yeah, it's a good question. And I think to start off, it is important to acknowledge that when folks get sick with an illness, a viral illness, the majority of individuals are going to develop some immunity or some immune response. And so we see that whether you get a cold, whether you get the flu, is that your body fights off the infection and you have some immune response. And so you'll have some immunity. Now, the problem has been, and this has come up a lot in the scientific literature, the problem is in how good are we at determining how effective that immunity is. And so when we look at folks who have COVID, and we all know individuals who have had COVID who had few, if any, symptoms. We know individuals who have COVID who got really sick, some individuals who maybe have been hospitalized and even been in the ICU. And so people get very different types of illnesses and very different types of symptoms with COVID. And we also know that from an immunity standpoint, we can see that as well. Some individuals get COVID and have a very robust immune response as they recover and really do have pretty good immunity and probably are protected for a significant period of time against the new infection. Some other individuals, however, may get COVID and may not develop as robust of an immune response and may get infected again fairly soon after. We don't have a really good way in science of looking at an individual and saying your recovery and infection puts you at no risk or low risk or moderate risk. And so that has been one of the challenges. And so the thing we know from vaccines, though, is that vaccines actually cause a fairly predictable immune response. And so we know when individuals get vaccinated and they get the 2 shots, and now really even with the booster, and we can talk about boosters later, that they actually have a very good and very predictable immune response, and to the effectiveness rate of around 90% against severe illness and severe disease. So that part has, I think, been a lot more useful from a science community, because now we can say everyone who's gotten vaccines, we know the type of immune response you have. And so while certainly some individuals can get sick and recover and be immune, some may not. And we have seen that a little bit in the recent Omicron and some of the other recent outbreaks, where people who had natural infection and never got a vaccine were 2 times more likely to get reinfected than individuals who got vaccinated. So in the end, really, this is around, particularly for us as healthcare providers, we want to have the assurity of knowing that an individual who has gotten the vaccine series is going to be at a much lower rate of getting sick, requiring hospitalization, going to have less risk of spreading it to their patients and causing their patients. So that's really the reason why, even if you've had COVID and recovered, you still need to get a vaccine so that we have a predictable and a reliable immune response.
Great, thanks, Dan. And just to add also, the CMS mandate as it currently exists does not allow for consideration of natural immunity. So that's the one we're under, and that's the one we're following.
It may also be good to add that one can get the COVID vaccine after recovering from COVID illness. You do not have to wait a long period of time before you get the COVID vaccine.
Yeah, that's right. Just the only requirements people had is if you currently are infectious with COVID-19, right. So you actively have symptoms, you're under isolation, they don't want you getting the vaccine, and in part so that you're not exposing individuals at the sites providing the vaccine or out in the community. But afterwards, yes, you can get the vaccine at any time. So it's a great point.
Great. So Dan, you mentioned boosters. So I wanted to ask Maria about boosters. So number one, it is a booster requirement for compliance. And then number 2, regardless of the compliance aspect, are boosters a good idea and why?
Great question. So to clarify, for the requirement of the CMS, boosters are not required. A full complete series of the 2 Moderna or Pfizer or one of the Johnson & Johnson vaccine isn't enough to meet that requirement. Saying that, though, getting a booster is a fantastic idea and really what we would encourage everybody to do. And the reason for that is that with these vaccines, similarly to many other vaccines, the immunity, the protection you get from them goes down over time. And this vaccine obviously have been very carefully studied, and we have kept such close eyes on this vaccine and the protection we get. So we do know that over time, that protection, while it stays up for sort of really severe illness or protection against death, the protection goes down when it comes to getting the infection over time. So getting that booster really sort of really does exactly that, boost the protection against getting COVID and keeping your immune response really responsive to it, and really is a good idea to keep up with the booster and keep an eye on those recommended times for when you should get it.
Yeah, and the data we've seen from the Department of Health and when we've met with them and talked with them really does confirm that. When we look at people during the Omicron surge who were hospitalized with COVID-19, who required critical care or who died from COVID-19, far and above, it was unvaccinated individuals. Then there was a smaller number of individuals, much less, who were vaccinated, who still got sick, but the smallest number of all were those who were vaccinated and boosted. And so you really saw very few individuals around the state who were vaccinated and boosted. And then when we dig into those, it's typically folks who would be at high risk of getting severely ill because they just don't mount a good immune response, even with the booster. So individuals who may be receiving treatment for cancer with chemotherapy or have a variety of other medical conditions. So boosters across the board and in every state have really done exactly that, which is that even though individuals might have gotten Omicron because it really did mutate and change quite a bit, it did a phenomenal job at keeping them out of the hospital.
And a related question on boosters. So given the low effectiveness rate for the Johnson & Johnson vaccine, will booster shots be required for staff who received the Johnson & Johnson vaccine?
So what we know at this point, that's not the case. One, Johnson & Johnson at this point is still counted as a fully vaccine. Whether that will change or not, we can't answer at this point.
Yeah, I think from this one, yeah, you're right. And it is, the reason you've seen some confusing stuff on that is that although Johnson & Johnson vaccine is still pretty effective vaccine, when we look at, across the board on vaccine effectiveness, the mRNA ones, the Pfizer and the Moderna one are so much better at preventing people from getting sick. And then with the boosters, so much more effective that ultimately down the road, CMS and others started, or the CDC and others started recommending it probably makes more sense for folks to start with the mRNAs if they get the opportunity.
Yeah, and that's also where the period of time that when the booster was recommended was much shorter after Johnson & Johnson.
All right, the next series of questions were about exemptions.
Yeah, they're yours.
And so they're mine as the lawyer here. So there's two categories of exemptions. There's religious exemptions and medical exemptions. There was a question about will religious exemptions be honored with Medicaid and Medicare? The answer is yes. This sort of stems from the First Amendment of the Constitution of the United States, that there is, and all the related both law and case law that's followed from that there, the government cannot compel anybody to receive medical treatment against their will. And so there is a religious exemption process that we are obligated to follow. It gets tricky, it gets complicated, but essentially the phrase that we use is a sincerely held religious belief. So if getting the vaccine violates a sincerely held religious belief, and you attest to that, and that we will review and grant those exemptions. We can't say for sure if every exemption will be granted, if a certain percentage will be granted, because we have to take a look at those individually. These are individual beliefs and individual exemption requests. As far as medical exemptions, Maria, I don't know if you want, you've been reviewing the exemption requests that we've gotten. I don't know if there's anything you want to add on the medical exemption side.
No, I think most importantly, I want to say that those are also individually reviewed, and they require the explanation of the medical exemption and the documentation from a medical provider for the reason. And I do think it sort of connects a little bit to what we talked about just recently here, that having had COVID infection recently will not be granted as a medical exemption for not getting the vaccine.
Yeah.
Other than that, they are closely looked at on an individual basis.
Great, thank you. So bottom line with exemptions, they're individual, and we encourage you, if you have not done so yet, to submit that as soon as you possibly can. And so related to that is the question came about, is there an appeal process for denied exemptions? The answer is yes, and that will be essentially contact your employee relations representative, and they will assist you and guide you through the process. Again, we take this very seriously, both the importance of the vaccine as well as honoring the due process rights of the folks that work for us. So, we will certainly honor that process as it continues. All right, the next question, Maria, is for you, and this was about masks. And essentially, the question is, if vaccines are so great, why do we have to wear masks?
So up to date, yes, the vaccine is great. I want to sort of push for that still. Vaccine has protected greatly from severe illness. It has protected from hospitalization and certainly from death. When there is a lot of COVID virus around, we need additional protection beyond what the vaccine has been provided when it comes to sort of spreading the virus and getting infected. So we added the masks when it came to sort of, in addition to the vaccine, the protection of really spreading the virus and getting infections. And the vaccine played, the masks played a really important role in that. And that's why we had it in place. When the community spread of COVID changes, and if there's less COVID virus around, those the guidance around masks may well change. So
yeah, the only thing I'll add on there is you've probably heard some confusing, I know folks have brought up to me some confusing information around what masks are effective. And so one of the things that sometimes folks will say is, well, only an N95 or a KN95 mask is effective. That's not accurate. So what the CDC and others have done is they really have gone away from recommending the cloth masks. These are the masks that people made or maybe buy at a local store. Like in a hospital, and I still work in an emergency department, and I still see patients who have COVID-19. For the most part, we're wearing the standard surgical masks or the medical masks. Those are 3-ply. They have a layer in there that really does decrease, and it prevents a large amount of particles, particularly droplet particles, from going through the mask if I'm breathing, and also protecting my nose and my mouth from particles coming in. Now, an N95 or KN95 mask are the most effective. They block out the largest number of particles. And so certainly as a medical provider, we still will put those on if we're having to do a procedure or if we're going into a room where somebody is really sick with COVID and actively sick with COVID. But surgical masks are effective. So I wouldn't say that it's that only KN95 is effective. It's that most individuals in the community really don't have access to medical grade surgical masks. And so by saying that, the KN95 masks have become widely available, and we certainly know are more effective than the vast majority of cloth masks out there. And I would also say that if you've followed the pandemic from the beginning closely, as you've seen, as Dr. Finnell said, you're going to see different guidance around masks. So we had masks, and then after the first wave, there were CDC recommendations that if you were vaccinated, you didn't need to wear masks anymore. But then we got Omicron, which was a new variant, and that Omicron virus had changed enough that having the vaccine alone was no longer enough to prevent you from potentially getting COVID, even though it did a really effective job at preventing you from getting sick with COVID. So again, knowing that, then the recommendations came to wear masks again. But as Dr. Finnell said, I think as we follow along, as we continue to see declining cases, you may see some additional changes coming out from the CDC and from the Department of Health on mask requirements as the community levels, hopefully, knock on wood if there's wood in this room, it continues to decline the way it's been.
Anything to add, Maria?
no, I think that sums it up really well.
Great. So there's also some additional questions just about a couple aspects of the vaccine. Dan, you've answered this a couple times, so I'm gonna go ahead and restate it, and then if you wouldn't mind, just
Lawyers do that really
tell
well.
me if
I'm gonna
okay, I'll know.
tell you what you said.
Pressure's on. So there's a series of questions around how COVID, the vaccine does not prevent somebody from getting COVID.
Yeah.
But I think that what is very clear from the data is, number one, it does actually reduce your chances of getting COVID, period.
It does.
Correct.
And then, but more importantly, it significantly, drastically reduces your chances of serious illness, hospitalization, or death. Is that?
Yeah, you did a really good job of summarizing it. So that's, I think, one of the, again, frustrations folks felt is that they got vaccinated, and even some folks who got boosted, and then they knew individuals who, this person was vaccinated, this person was boosted, and they still got Omicron. But really, at the end of the day, the thing that was most important is, did they get sick enough to require hospitalization? Did they end up in ICU? And the data is incredibly clear on there. If you were vaccinated, boosted, no, the probability of you needing hospitalization and critical care was dramatically lower. But if you look across the board, people who are vaccinated and boosted still have a lower rate of getting COVID across the board. They do. It's just that it's not like 90% anymore where it was initially. And so you'll see folks who were vaccinated and still got COVID. The other thing to keep in mind is that when you're vaccinated, particularly vaccinated boosted, and you get COVID, and you're less sick with COVID, that also means that duration of time that you have symptoms is shortened. So you're not sick as long. And the amount of virus that you have inside of you is also lessened. So it also, even though you may get COVID after vaccine, after being vaccinated, you actually, because you have symptoms for a shorter period of time and less virus, you also probably decrease the risk of spreading it or getting somebody else COVID-19 as well. So the vaccines are still really important and are going to stay, I think, a critical part of this. If somebody's out there and is like, I never got vaccinated and I don't feel like I need to, you still really should get vaccinated. And you know, we don't know how this will change in the upcoming months, so I would fully anticipate, and at least we should be prepared that we may need additional vaccines at some point. It may be next winter, like we do with seasonal flu. We don't know that yet, but I would say that we'll just need to keep following the data really closely to see where this lands.
Yeah, and then just a really important point, I think, is that science does constantly change. And so a lot of folks, I think, are understandably frustrated with the constantly evolving messaging. There was a point over the last summer where we thought that vaccines and vaccines alone were our ticket completely out of the pandemic. That's clearly not what happened with Delta and Omicron. And you know that I don't think that people that are in charge of these things necessarily did the best job with messaging, but the truth is vaccines and science change, and so we need to be prepared for more changes. And so I think that you know our kind of promise to you as the state and is that we will do our best to keep you updated with the changing information, but we do want to have folks to be prepared that these things are fluid. So
and I would just point out, yes, things have changed, but we have also learned an incredible amount about this virus and very specific. So we sort of expect that should we need additional vaccines or should we need the vaccine to look different, we now have the knowledge to sort of quickly respond to that, which is a huge advantage compared to where we started.
Well, and that's a great segue into the second sort of vaccine question, which I think, you know, we can't answer definitively, but I think that, you know, to your point, we know a lot more, and some of the science that's been happening is just incredible and miraculous, frankly. And then, you know, there's questions and concerns about long-term effects of the vaccine, right? What are they? What have been shown? And the truth is, we don't know what long-term effects are until the long-term happens. However, are there reasons you would suggest to folks that that perhaps would not be as concerned about long-term effects?
Yeah, I can start and you can add. Let me first, I think if you're going to talk about the risks of vaccines, particularly short-term and long-term, you also need to weigh the risks of getting COVID short-term and long-term. And certainly we've done that. I think one of the things that has become clear is that COVID infections are, first of all, even mild and moderate infections can have some long-term complications related to them that people don't think about. You know, in the news you hear like, oh, people had mild symptoms. Some of those folks actually can go on to have, they call long haul syndrome, where they can, and there's a variety of different symptoms they can develop. They can have sort of difficulty concentrating. They can have prolonged fatigue. They can have things where when they stand up, their blood pressure drops and they feel like they're going to pass out or their heart's racing. And there's a lot of individuals who had mild or moderate cases of COVID who really have persistent symptoms for months and months. So first and foremost, the risks long-term of having COVID, even mild, moderate cases of COVID are not, I mean, they're pretty high by comparison to the vaccine. And there's also a lot of data we don't know yet as to what your risks are if you had COVID and recovered in terms of your lung health. There is some data out there and some concerns that individuals who had, you know, pretty moderate or moderately to severe cases of COVID might have some long-standing lung issues. So first and foremost, getting COVID acutely, the risk is much greater than the vaccine, but also the long-term risks, even if you recover, are much greater. Now, in terms of the vaccine, we know that risks from vaccines, and so the answer that everyone who's asking the question is right to ask a question. Like, we should always be concerned about what are the risks of anything, any medicine that we're prescribed, any medicine we take by mouth, any one that we get as a shot. So people are absolutely right, I think, to start with the question as, what is the risk of this, and do we know what the long-term risk of this? Those are good questions. What we do know around vaccines, and although this is a different type of vaccine, vaccines kind of all work the same way. They all work by typically having a protein from a virus inserted into the body that causes your immune system to respond in a way that if it sees that the actual live virus and not just the viral protein, that it will kill it. So we have a fairly similar process for vaccines. mRNAs were different, but at the end of the day, it's about having a viral protein that activates your immune system. And we know when we look at all the vaccines, like people who develop problems from vaccines, it's typically within the first 2 weeks of the vaccine. We really don't have a lot of evidence of vaccines that cause delayed or problems down the road. And now we're looking at having had these vaccines for well over a year, and we aren't seeing any of these delayed or these long-term really effects from the vaccine. So, people say, what about 5 or what about 10 years down the road? We just really don't have a history of the vaccines that we see that. Will we continue to follow the data? Of course, and we'll continue to monitor it, but we really aren't seeing any of those delayed effects that we would from the vaccine.
Absolutely, and I would add that a vaccine is a very controlled immune response versus having a natural infection is a rather uncontrolled, can be very strong, as you mentioned, in some people and much weaker in others. So it's a controlled immune response. And in history of vaccines, one thing that's coming up so often around the COVID vaccines are the effect on fertility. And in the history of vaccines, we have had infections that have surely had changed fertility for people quite a lot. We do not have that history with vaccines changing fertility. So we have no reason to believe that to be different with the COVID vaccines. And I know that's a big sort of discussion. Lots of people have questions about fertility, but no evidence that that would be changing with the vaccine.
The last thing I'll add to that is I think that this is the most transparent and studied kind of process that I can ever remember, as a layperson. Like, people talk about the VAERS, the Vaccine Adverse Effect Reporting System. And, sometimes people will say that that's like a gotcha. That thing is up there. It's a publicly funded, publicly maintained database for people to report raw data into. Nobody's hiding anything. This is transparent. It's well studied. I think that, we'll continue to be, I think is the point, right?
Yep.
So that's a really important.
Yeah, there was over 200 million people in the United States have gotten it. Not a lot of vaccines in that time frame where you can say it's a pretty large number of folks. We've got a lot of data from Indiana, well over 3.5 million folks as well that have had the vaccine. So we've got a ton of information on the safety. Best studied vaccine that's ever come out. I think we've know more about this to some extent in the short term than we've known about any vaccines.
Yeah, well, and a consequence of large numbers, right, is that you'll have outliers on either side.
I absolutely think we should comment on that. That also means that we will find those very, very, very rare things, and sometimes without knowing whether they have anything to do with the vaccine, but which has been on full display for this particular vaccine.
Yeah.
Great. So the last couple sets of questions were more about hospital policies and procedures. So I'll go ahead and handle those. The first question was about how will new hires be addressed? Will they need a completed series of vaccines or submitting exemptions prior to hire, or is there a time frame for that to be completed? And so what we've arrived on in compliance with our best compliance with the CMS mandate is new hires will not need a vaccine right away. They'll be educated on the vaccine requirement during the hire process. And then they will have 60 days to either complete the series of vaccinations or submit and have an exemption approved. And so then the final question was about vendors and gatekeepers. There's many folks that don't work for the hospital or that will also be in areas where patients are. Will they be required to be vaccinated? And so it's a bit of a tricky question. I think when it comes to gatekeepers, the gatekeepers are all employed by the CMHCs who fall under the CMS mandate. Therefore, they are going through the same process we are right now. With vendors, it's a little bit of a sort of individualized situation. If it's a recurring regular vendor, I think that we're much more likely to sort of require that COVID vaccination proof on file. If it's a one-off situation, then I think we regardless, they're required to wear masks and they're required to take other precautions. So really our whole mission is to keep the patients as safe as we possibly can. And we've done a very good job of that so far through the pandemic.
So, and yeah, with that, as again, thank you all for all that you've done throughout the pandemic and continue to do. We know the work at our state hospitals is difficult work, but also rewarding work. And one of the reasons that you went there in the first place. So thank you on behalf of the patients that you take care of. And for those that will be going out and getting your vaccine, also thank you because you're doing that ultimately on behalf of those you care for. So again, thanks everyone and stay safe.